Today we had a description of the new coronavirus, the COVID-19, why it's a potential health threat, how do we prepare, and the take-home message here is that preparedness for our healthcare system, for America, is really what this is about.
Many Americans throughout New Jersey and the nation are justifiably concerned. But it's important to remember that the vast majority of the coronavirus cases are considerably mild. If there's anything we know, it's that now is not the time to panic, but rather to prepare.
We want to allay fears. We want to demystify what this virus is about, who's at risk, what the potential is for serious disease. It all comes down to how prepared are we to address this virus, and that's what today's program was about. When you have a situation where you don't have a vaccine, the best thing you can do is diagnose early and effectively, triage your patients, and understand what you're dealing with. Senator Menendez has been a leader for healthcare in America. He's a strong advocate, not only for the citizens of New Jersey, but for all Americans. And he understands preparedness, and he understands that we need the tools to be prepared. And so what we talked to him about today was to help us validate some of the tools that we've developed in terms of new diagnostic tests. So his role as a senator and a leadership capacity is really critical for us.
Now, no one person can prevent a public health epidemic. That's why we need coordinated government response strategies to protect our public health and keep the American people safe. If a vaccine breakthrough is achieved, we have to make sure that every American in need is able to access it and afford it. Otherwise, it is a false promise. The United States is capable of answering any challenge so long as we have the necessary resources, a strategy to succeed, a respect for science, and a commitment to the truth.
As a scientist, I have an obligation to be able to transmit my knowledge about science to the public, to be transparent, to try to deliver some solutions, to help people feel both hope and to be able to communicate what science can really do for people. We're trying to understand what is the clinical problem and what is it that we know and understand about our science, what insights do we have, what tools do we have that we can use to address these unmet medical needs. And that's why I came here. I came here to be able to do this.
What we have to do is be prepared. That's why, I appreciate the efforts here to have a test that can help us be prepared to understand the scope. That's what I'm doing in the Senate, is to create the resources and to condition the resources so that they're not spent frivolously. Now, we just have to put our hands together and try to make this happen in support of the American people and in our safety and security, and that's what we will do.